Inspire Health Talk Show.
Hey everybody, welcome back to the Inspire Health Talk Show. So today our topic is on type 1 diabetes. We're going to be answering some key questions the listeners have about this topic. Today we have with us some guests. They are public health nurses. Do you guys want to introduce yourselves?
I'm Taylor.
Hi, I'm Maria.
Hi, I'm Elia.
If you didn't know, type 1 diabetes is a disease where your body cannot make something called insulin. So in your body, there's this organ called a pancreas, and the pancreas has beta cells. And these beta cells normally produce insulin. But in someone with type 1 diabetes, their body destroys the beta cells and they can't make insulin anymore. So I represent sugar, and I use insulin, or my key, to let myself into the body cells. So that takes the sugar out of the blood and into the body cells so that the cells can use it for energy. Okay, and so imagine if you didn't have insulin. So me, sugar, I wouldn't be able to get into the cells. I'd be trying to get in, but I couldn't get in. So then the sugar would keep building up and building up in the blood and wouldn't be able to go anywhere. This would cause a sugar overload, which is dangerous, and it damages your body and hurts your body. And so the way to treat type 1 diabetes, where you can't make any insulin, is to have a medication called insulin.
Now that you understand type 1 diabetes, you can start calling in any questions you have for us at the number 902-867-3333.
Hi, my name is Melissa and I'm 14 years old, and I was recently diagnosed with type 1 diabetes. And my doctor told me to watch out for fruity breath, and I was just wondering why.
Thank you, Melissa, for your question. So today the question we'll be answering is, what causes this fruity breath and why is it important? So we're going to be talking about something called diabetic ketoacidosis. So I'm going to hand this over to the professionals now.
So think of your body like a car. Your car has a lot of gas, just like your body has a lot of sugar. But you lost the key, or insulin, to drive. Just like your car needs a key to drive, your body needs insulin to use the sugar for energy. So you think your gas tank is empty, so you decide to pump your car full of more and more gas. But without the key, the extra gas still won't make your car turn on and drive. Just like in the body, without insulin, the sugar cannot enter the body cells to use as energy. Why won't my car start? Maybe I need a different type of fuel, like diesel, to make my car work. So I go to the gas station and pump my car full of diesel. Diesel represents ketones in the body. So your body starts to use ketones for fuel. Your body breaks down fat, which makes ketones that are used as energy. But just like diesel can be toxic for your car, too much ketones can hurt your body. Your body cannot create insulin, which is your key. So you need to take insulin medication so your body can use the sugar as energy. But if you're not taking the right amount of insulin, or if you're sick, then you can enter DKA. And this can happen pretty quickly, in a few days to hours.
Does that make sense to you, Melissa?
That makes a lot more sense than how my doctor explained it. I understand how important it is to take my insulin on time so my body can use the sugar for energy. So what would happen if I did go into diabetic ketoacidosis?
At this point, other systems in your body are starting to shut down, and you must go to the hospital to get the proper help you need. At the hospital, the nurses and doctors are first going to fix your body's low level of fluids. These are the fluids you lost through peeing too much and vomiting. Fluids are given through a small tube into your arm to make sure you do not throw these fluids back up. Next, the doctor will check your body's potassium level. Potassium is something in your body that helps your heart and muscles keep working properly. Potassium will be given along with the fluids through the tube in your arm.
Once fluids and potassium are given, we can now start the car with the key, insulin. Your nurse will give you insulin so your body can use the sugar for energy again. Now that our car is up and running again, we must watch our gas level, aka sugar. and our potassium level, because insulin may lower them too much that we run out of gas. The diesel or ketones the car has been using will make the body more acidic, which means the body is not going to work as well. So the doctors and nurses will give sodium bicarbonate into your arm, which will help balance your body's acid levels. The nurses and doctors are going to help you feel much better and allow your car to run smoothly.
You're more likely to get diabetic ketoacidosis if you don't know you have diabetes, if you just were recently diagnosed with diabetes type 1, or if you're having trouble controlling your blood sugars. You're also more likely to get DKA if you have a cold or flu, if you forget to take your insulin, if you miss a meal, or if you take the wrong insulin dosage. When you have controlled blood sugars, it helps you avoid complications such as diabetic ketoacidosis.
So Melissa, when are you more at risk of getting diabetic ketoacidosis?
So I have to be more careful when I am sick. That's why my mom gets so worried when I get a cold. I need to be more careful when I miss a meal and when I don't take my insulin on time.
Yes, exactly.
Too much diesel or ketones are like poison to the car and body. It causes a lot of acid to build up in your body, which makes you confused and maybe even pass out. Remember, your car also has way too much gas or sugar in its system. It has no way to use this for fuel because the car will not turn on, so the gas starts to spill out of the car. In your body, all the extra sugar spills out of the body in your pee. Now this may seem like a good thing because you're getting rid of the sugar, but all the water in your body follows the sugar and leaves in your pee too. This is why you also pee a lot if you have diabetic ketoacidosis. This is why you also pee a lot if you have DKA. This is bad for you because you don't have enough water, so you are very thirsty and dry. Your body is so thirsty, which causes you to be more confused and cranky. Another thing that happens when your body uses ketones is that it produces substances that will hurt your stomach, cause you to feel sick, and even throw up.
Your doctor or nurse will assess you for high levels of sugar in your blood. They will also check if your mouth and lips are dry. They will check how fast your heart is beating. And if your blood pressure gets low when you stand up. The doctor will also check your pee for ketones, because the extra ketones or acids will spill out into your pee with the extra sugar.
So Melissa, what sort of things would you be looking out for if you suspected you had diabetic ketoacidosis?
I'd pee a lot, my mouth would be dry, and I'd also be throwing up and be really cranky and confused. I might even pass out.
That's right, Melissa. Now to finally answer your burning question about what causes this fruity breath.
The reason why your breath smells fruity is because with type 1 diabetes, you don't have insulin to break down the sugar in your body to use as energy. Because of this, your body has to break down other forms of energy, such as fat. When it breaks down fat, it is going to produce things called ketones, which are acids. A common type of ketone is acetone. You may have heard of acetone because it is sometimes found in nail polish remover. When you have high levels of ketones or acids being produced, you are going to breathe very quickly and heavy to try to get rid of all the acid that your body is making. Breathing out the acid is why your breath will smell fruity, or like acetones.
Yes, I am going to watch out for fruity breath because that would mean I have too much acid in my body, which is not good.
So now that you understand why you might have fruity breath, it is important to know what you should do if it happens. If you are experiencing fruity breath with other symptoms of diabetic ketoacidosis, such as heavy and fast breathing, peeing too much, stomach pain, or throwing up, then you should check your blood sugar level and go to the emergency department right away.
Thanks so much for answering my question. I feel like I can take care of my diabetes a bit better now.
All right, that's all the time we have for today. Thanks again for calling in, Melissa. We hope you learned a thing or two. Until next week.